I think that, well, I won't say what I think that did to me. But yeah, so I'm the other online behavioral health company. I'm Phillips, the CEO and co-founder of Empower Interactive. So Empower takes evidence-based talk therapy techniques and transforms them into an engaging e-learning experience to make solutions for mental and behavioral health problems much more cost-effective and much more accessible. So I'm part of a team that's come together that includes passionate individuals from the clinical, business, and product domains, starting with Dr. Jess Wright, MD, PhD, and professor of psychiatry at the University of Louisville, and the US's leading researcher in computer-assisted therapy. Kara Chanasek, who comes from Stanford's Persuasive Technology Lab and is an expert in designing user interfaces to drive behavior change. Our business team, Fermín Caro and Chris Keegan, with backgrounds in both internet and healthcare industries. Joseph Pertl, our star software architect, who actually was a trained physicist before switching over to software development. And myself, I actually studied artificial intelligence at MIT, then got an MBA at Stanford. I've worked as a software executive and a venture capitalist. So why have we come together? Well, this is the problem. Not just that healthcare costs are high, we know that, $2 trillion. But as Rebecca mentioned earlier, it's the 75% of this that's spent on individuals with chronic diseases, particularly things like heart disease and diabetes. And the big problem about those, but also the big opportunity, is that the bulk of that is caused by our own behavior choices, the ways that we choose to live our lives. And that provides an opportunity because those behavioral issues, which range from things like depression and anxiety to insomnia and weight management, all can be potentially solved, but not with the traditional solutions, pharmacology and talk therapy. They're much too expensive, they're too inaccessible, they're too stigmatized, too many side effects. So what else can we do? So the Empower solution, talk therapy methods that work transformed into e-learning. So our underlying platform stores what we call the cognitive graph. This will be the events, the behaviors, the thoughts that you'd put into our system as you use the e-learning products. We combine that with our content database based on the cognitive behavioral therapy methodology and use those to generate customized e-learning experiences for each individual to teach evidence-based coping techniques. We also provide interfaces to clinicians and administrators. And as people use the system, we get smarter because we're collecting data on what works, and thus the next customized interfaces that we generate are going to be better. So ultimately, what we're providing is a toolkit to the end user to identify, evaluate, and change dysfunctional thoughts and behaviors. So let's take an example. Have you ever had the experience where the phone rang and it was someone important and you just got a pit in your stomach and you didn't answer it because you irrationally feared it was going to be some really bad news, and even though you knew that not answering the phone could potentially damage your relationship with that individual? So I'm going to walk through one of the exercises in our program that can help you work on this kind of problem. And I don't know if you can read it, but I'm trying to make the example particularly clear for the VCs in the audience. So what you would do here is you would first you would record things, you'd record the event. You would then actually record the thoughts that were going through your head as this event happened. You'd record the emotions that were happening, and you quantify those. Quantification is very important here. And then we take you through some steps where you'd reassess. Is this a rational and constructive response to this particular event? Might pick particular thinking errors like ignoring the evidence or jumping to conclusions. And at the end, you would get a summary screen that would give you a reflection of what was going on in your head. It would organize your thinking. It would give you an action plan for next time. The whole point here is that this methodology, which is, as I say, evidence-based, helps you retrain your thinking to try something new. The same way you might have to retrain your golf swing. You might have to take a step back, reflect, and try something new. And that's what we do with your thinking and behavior patterns. And that's what can change those behavioral health issues. So where we're starting is depression. And we offer our solution in two versions. A clinical version, which we sell to payers, where it's used in conjunction with traditional talk therapy, but makes it much more structured and much more efficient. And a self-guided version, which we sell to employers and consumers, which provides it for more mild symptoms. On the clinical side, I want to just point out we have published clinical evidence that we can cut the number of talk therapy hours needed for depressed patients in half, yet achieve the same outcomes of reduction of depression symptoms. And our current NIH study that's now underway is actually cutting that by 2/3. And on the consumer side, we're actually really excited to announce that today we are launching, in conjunction with Healthline, a major consumer health company, the helpfordepression.org site and our consumer version of Good Days Ahead. So I know none of you are anxious or depressed, but just in case you know someone who is, please send them there. So just to summarize, our products are in the market. We've had a very successful pilot with the U.S. Army and are working on a very exciting relationship with them that I wish I could tell you more about right now. Beyond that, we have a robust enterprise pipeline. As I mentioned, we primarily sell to employers and payers. We're clinically proven, and we are raising our Series A. But I'd love to talk to anybody who's interested in the future of behavioral health. Thank you.